February is Heart Month, and the Washington County Heartland Youth Coalition wants you to be heart healthy. Tobacco-related illnesses and deaths are among the highest in the nation right now, here in Kentucky. We don't want to be the #1 in deaths related to tobacco use. Kentucky has made strides in reducing the number of smokers. Here are some facts. Fewer Kentucky teenagers are smoking, according to a study done by the Cabinet for Health and Family Services. Not only that, but less than 20% of youth in Kentucky are smoking. But we still have the highest rate of teen smoking in the nation. Not only that, but less than 25% of adults are smoking now. The majority of Kentuckians are not smoking.
Most people associate smoking with breathing problems and lung cancer, but did you know that smoking is also a major cause of heart disease for men and women? Almost 20% of all deaths from heart disease in the U.S. are directly related to cigarette smoking. That's because smoking is a major cause of heart disease. A person's risk of heart disease and heart attack greatly increase with the number of cigarettes they smoke. People who smoke have a greater risk by 4 times the chance of having heart disease, and smokers continue to increase their risk of heart attack the longer they smoke. Women who smoke and also take birth control pills increase several times their risk of heart attack, stroke, and peripheral vascular disease.
Cigarette smoke not only affects smokers. When you smoke, the people around you are at risk of health problems, especially children. Environmental smoke, also called passive smoke or secondhand smoke, affects people who are frequently around smokers. Secondhand smoke can cause chronic respiratory conditions, cancer, and heart disease. It is estimated that 70,000 non-smokers die from heart disease each year as a result of environmental tobacco smoke.
How does smoking increase heart disease risk? The nicotine present in smoke causes heart disease by decreasing oxygen to the heart, increasing blood pressure and heart rate, increasing blood clotting, and damaging to cells that line the coronary arteries and other blood vessels.
How can quitting smoking be helpful? Now that you know how smoking can be harmful to your health and the health of those around you, here are some ways quitting can be helpful. If you quit smoking, you will prolong your life, reduce your risk of disease, including heart disease, heart attack, high blood pressure, lung cancer, and other conditions. Feel healthier after quitting. You won't cough as much, and you will increase your stamina. Look better. Quitting can help you prevent face wrinkles, get rid of stained teeth, and improve your skin. Improve your sense of taste and smell, and you will also save money.
How to quit smoking. There's no one way to quit smoking that works for everyone. To quit, you must be ready both emotionally and mentally. You must also want to quit smoking for yourself and not to please your friends or family. It helps to plan ahead. This guide may help you start.
What should I do first to stop smoking? Pick a date to stop smoking and then stick to it. Write down your reasons for quitting smoking. Read over the list every day before and after you quit. Here are some tips to think about. Write down when you smoke, why you smoke, and what you are doing when you smoke. You will learn what triggers you to smoke. Stop smoking cigarettes in certain situations, such as during your work break or after dinner, before actually quitting. Make a list of activities you can do instead of smoking. Be ready to do something else when you want to smoke. Ask your doctor about medication or about using nicotine gum or patches. Some people find these aids helpful. Join a smoking cessation support group or program. Call your local chapter of the American Lung Association.
Here are some tips to help you avoid smoking. Don't carry a lighter, matches, or cigarettes. Keep all of these smoking reminders out of sight.
If you live with a smoker, ask the person not to smoke in your presence, or better yet, to quit with you.
Don't focus on what you are missing. Think about the healthier way of life you are gaining.
When you get the urge to smoke, take a deep breath, hold it in for 10 seconds, and release it slowly. Repeat this several times until the urge to smoke is gone.
Keep your hands busy. Doodle, play with a pencil or straw, or work on a computer.
Change activities that were connected to smoking, cigarette, take a walk, or read a book instead of taking a cigarette break.
When you can, avoid places, people, and situations associated with smoking. Hang out with non-smokers or go places that don't allow smoking, such as movies, museums, shops, or libraries.
Don't substitute food or sugar-based products for cigarette smoking. Eat low-calorie, healthful foods such as carrots or celery sticks. Sugar-free hard candies or chew gum when the urge to smoke strikes so you can avoid weight gain.
Drink plenty of fluids, but limit alcoholic and caffeinated beverages. They can trigger the urges to smoke.
Exercising will help you relax.
Get support for quitting. Tell others with pride about your milestones.
Work with your doctor to develop a plan using over-the-counter nicotine replacement aids or prescription medication.
Here are some ways you might feel whenever you quit smoking. You may crave cigarettes, be irritable, feel very hungry, cough often, get headaches, or have difficulty breathing. These symptoms of withdrawal occur because of your body is used to nicotine, the active addictive agent within cigarettes. When withdrawal symptoms occur within the first 2 weeks after quitting, stay in control. Think about your reasons for quitting. Remind yourself that these are signs that your body is healing and getting used to being without cigarettes. The withdrawal symptoms are only temporary. They are the strongest when you first quit, but they will usually go away within 10 to 14 days. Remember that withdrawal symptoms are easier to treat than the major disease, like heart disease and lung cancer, that smoking can cause. The good news is that after 1 to 2 years of not smoking, your risk of heart disease is greatly reduced.
The Rise Youth also has other tips that will help you make a healthier and your family have a healthier lifestyle. If you go to a restaurant, make sure it is a non-smoking restaurant. Most businesses are choosing to go non-smoking for the health of their employees. If they allow smoking, make sure you sit in the non-smoking side, even if you do smoke. That would increase the likelihood of you smoking during dinner. Get regular checkups, especially if you smoke. Cancers from smoking can be addressed early with early detection. Smoking is a habit, so make a new habit and smoke outside of your house. This will keep your children safe from deadly secondhand smoke.
Thank you for joining us today for the Washington County Heartland Youth Coalition and the prevention tactics from the Rise Youth. We want to thank our Rise Youth group for their dedication and their hard work that they put into this group. It's an awesome group of young people and we appreciate everything they do. Also, remember several of our upcoming events. On March the 24th, we are going to have a dessert auction, and Channel 6 is sponsoring that with the Rise Youth and the Heartland Youth Coalition and the Kentucky ASAP from Marion, Nelson, and Washington. So get those desserts baking and drop off any desserts from Washington County at the Board of Education on the 22nd of March. Then on the 28th of March, we will have our wonderful town hall event that we host every year in March. It will be at Mordecai's. Please let me know if you would like to come, and our focus will be on prescription drug abuse and underage drinking. For more information about the town hall or the dessert auction, please call us at, myself or Isaac Fry, at the Board of Education at 336-5470. Thank you.